And my name is Joseph Ramirez. I work here at the Oregon Health Authority as the HIV prevention specialist, and I help manage our HIV prevention funding to our local public health authorities and our community-based organizations here in Oregon so that they can do HIV prevention activities under program element 7. So a lot of you are here today, and thank you so much for registering. And to our presenters, we're really excited to have you, and we hope that we can have a really engaging and productive webinar today. So please prepare any questions. We have 3 presentations, so feel free to jot any questions you have in the chat box. There will be time for Q&A after each presentation. And then I'll be monitoring the chat box and sharing any questions in case you don't want to speak out loud. I'll read those aloud. So again, my name is Joseph Ramirez, and here with me today co-facilitating is Javier. Javier, would you like to introduce yourself?
Hello, everybody. Javier Salcedo, HIV STD Interventions Coordinator here at OHA. My role is a little bit with the HIV prevention and the STD prevention teams. I also do a lot around PrEP, the PrEP navigation contracts, Take Me Home, also special needs funding, and HIV Oregon. Happy to be with you all here today.
Thanks, Javier. We have a bunch of other people here today from OHA, but they won't be introducing themselves just for sake of time, but Shelly did put in our chat box, feel free to message her if you have any technical issues, and we can work through those. So again, my name is Joseph. Today's webinar is Digital Outreach and Engagement Strategies. So using social media influencers for HIV prevention. And we're really excited to have this webinar here today. For the purpose, we've heard a lot from our partners this last year during the pandemic, the need to use technology to share prevention programs and activities. Switching over from in-person outreach to digital outreach is essentially where the technical assistance has been shared with us. This is a need. A lot of our programs and a lot of our partners throughout the state have awesome strategies. They use social media, they use radio ads, they use targeted messaging on dating apps. And we reached out to our presenters who are also doing similar things and have had extreme success in reaching populations, different populations, using several of those methods, but also more innovative strategies. So again, we're really excited to hear from them today. We know since the start of the pandemic that a lot of in-person services have been suspended, that there's been a lot of interruptions in the ways that we usually reach our communities. So using social media and marketing, particularly influencer marketing, is essential at this point where we are today. It remains an untapped tool for public health in general, as in, there's no streamlined process for everyone to do it. We hear a lot of the times that who essentially is in charge of doing this? Does the state do it? Do our CBOs do it? So today's presenters will share how they've gone about it and share, their successes and any tips they have for us here. So we're really excited to have 3 presentations and several presenters. And they have done work, developing social media content, finding funding to pay for the social media influencers to promote prevention messaging, conducting at-home prevention activities, or sharing tests or PrEP and other resources. So Javier, would you like to briefly introduce our speakers?
Yes, so thank you so much for giving this introduction. We have, like you said, 3 different organizations nationwide. We have Manny Muro from Radiant Health Centers in Irvine, and then we have Ramakita from Whitman Walker in DC, and then we have both Mario and Javier from Howard Brown in Chicago today. And if we're ready, we can go ahead and get started. All right, we'll get started with Manny Muro. I had the pleasure of working with Manny Muro at Radiant Health Centers in Orange County, California. So really excited to bring him on board. Let me tell you a little bit about Manny. Manny Miro. Manny Miro is a proud queer Latinx man who was born and raised in Southern California. As a lifelong resident, Manny has a passion for serving his community that shaped him throughout his life. Manny is currently the Outreach and Education Coordinator for Radiant Health Centers, which is Orange County's largest provider of LGBTQ health and social services. Manny is working to eliminate stigma and overcome health disparities impacting the LGBT community. Manny also serves as the chairman of the OC PrEP Coalition, whose mission is to decrease HIV transmission rates by educating, empowering, and connecting individuals to biomedical prevention tools. Manny also held the title of Mr. Gay Orange County and is currently the vice president of Orange County.
Yes, so I did. I got a new provider and I have a new phone number because on their end we couldn't complete the port.
If we could please mute ourselves, thank you so much. So I was saying, Manny held the title of Mr. Gay Orange County, and he is the vice president of the Orange County LGBT Pride, where he works to strengthen the identity of the lesbian, gay, bisexual, and transgender community within Orange County. So, Manny, you have the floor.
Thank you very much. That was a very long bio. I should have shortened that up a little bit. I just reused what I sent out. But thank you so much for having me, Javier, and thank you so much for everyone that's on this call. I really appreciate you taking the time and energy to be here today. What I'll be going over is social media influencer strategies and incorporating that with HIV prevention work. But before I do that, I'm going to go a little bit about organization. Next slide. So just really quickly, our vision within the organization is LGBTQ healthcare equity and ending the HIV/AIDS epidemic in Orange County. And then we provide LGBTQ plus community with medical resources and compassionate preventive care, as well as living with people. And excuse me, I'm just like, I have multiple screens. I'm reading in different places. And then continue to serve those living with or affected by HIV. And then the next slide. And then next slide, just click it again. Yeah, sorry, these are reused slides. And then, so we started in 1985, an organization. We used to be called AIDS Services Foundation Orange County. And then we did a rebrand not too long ago in 2017 because we started including medical services into our organization. So now we do hormone replacement therapy. We have providers on site now. So, we're really encompassing, we're not just focused on HIV prevention work, but just overall LGBTQ plus health equity. So some of our learning objectives today, I know that we have 3 presenters today, so I'm going to try to be as brief as possible, but please, I'll be monitoring the chat as well. So if you have any questions, just shoot them my way. But we're going to be exploring different channels of where social media should lie and where it should live at. How to create engaging content, how to make a post. So some of this might be a little simple, but I just kind of want to overview it just for the fact that not everyone is very good at social media. So kind of just doing a little overview of that. How to do Facebook and Instagram live events, how to post ads, the use of influencer marketing and collaborations, and how to use those influencer marketing to collaborate with organizations, the use of geolocated dating sites, and how do you measure all that? And how do you measure that success? And how do you adjust that? And I know there's a lot of people that are about the data, so I'm going to show you how to read that data. So a little bit, the next slide. So a little background, these are all pictures of me, they're all selfies. So no, but the reason why I want to put this slide is I'm very familiar with working with brands. I've worked with brands like McDonald's, Amazon, skincare and clothing and skincare lines. But I also use my own personal social media to amplify the messaging around PrEP and HIV prevention work. So I kind of merged the two together, and I use my social media as an example of what I do on my end. But that's what I want to emphasize in collaborating with organizations and other organizations, but also social media influencers, to how to merge that gap together. Because like you as an organization or a public health department may not be able to do all the things that maybe an influencer could do. And how do you merge the two together? So that's just kind of, I just wanted to highlight this is like merging the two together by a social media influencer, using their platform to go ahead and amplify the messages that are most impactful. Okay, so next we got, so the first thing we're going to do is explore different channels. So social media platforms and how to use them. So obviously a lot of people are familiar and use the social media platforms every single day. So Facebook, you could create a post photos, videos, host a Facebook Live event or a Q&A. On Twitter, obviously that's a lot condensed. It's a tweet that's 280 characters or less that contain hashtags. Make sure that your tweet is short, eye-catching, and straight to the point. Instagram is more about pictures, so post images, video clips, host an Instagram Live or an IGTV series. All right, so next we have how to make a post. Seems simple enough. You can just post something and it's out there, but you have to be a little bit more thoughtful and intentional about what you're posting. So first of all, you have to decide where the post is going to live at. So when creating the Instagram post, Facebook update, or tweet, use the appropriate post on the social media platform. So let's just say you have a text-heavy post that may not necessarily work on Instagram. That might just be a tweet, or that might be a Facebook update. If you want to share a website, that may be like a link to something, that might be a tweet. Let's say you have a flyer, an image that you want to promote, that might live on Instagram. So really be intentional about where your post is going to be living at. Also, one thing that you have to know is find your voice. You have to follow trends to be, and you have to follow trends first. You know, social media is very fast. So kind of like see what's out there. So follow the trends, be accurate, but also speak the language of your audience. So that's very important because I know a lot of times when I see posts, it's very clinical. So one thing that you have to be cognizant about is really just what language is your audience using? What language is your clients using? So you have to be mindful on that. And then always brand your content. You have to make sure that everything is branded because who is this coming from? People want to know. And then for every single post, you need a call to action. So there needs to be a homework assignment for your audience members, whether it's liking a post, whether it's following a link provided. Let's say you provide a link to your clinic site or an appointment or a call to action, make a phone call, or liking or sharing a comment or a comment below. Always include a call to action in a post. So I'm going to give you an example next. Here's an example. I made this really fast, so it's not the thing. But one thing I would say that four things that I always include is your logo or brand. Make sure it is branded because everyone wants to know where this image is coming from, who is posting it, and you kind of want the credit, right? You want what organization is posting this. Create an eye-catching image. So I found this image, I laid it over some text, but also I want it to be current. I think during this climate, everyone's kind of science is in question. So I really wanted to use that, I created the campaign for organization Science Over Stigma, and then we're including PrEP and U=U information on this. So we're using this kind of slogan, Science Over Stigma. And then that also includes a short and concise message. So 1 pill every day prevents HIV. Now, the thing is, if you want to include more text, that can be included in the caption, not necessarily the image. So make sure that the image is short and concise, but also there is a call to action on this image as well. And that call to action is that call us. So the 4 things that I mentioned earlier in the past slide, there's a kind of an example of how it's included into one single image. Okay, so next slide. All right, so these are some of the tools that I use. I use them interchangeably. It depends on what I'm doing. So one thing I always use is an Adobe Photostock image. The reason why I use that, anyone could easily Google an image and find an image, but do you have a license to that image? So with getting a stock photo image, you have a free range to use that image how you wish. That could be on printed materials, it could be on posters, t-shirts, whatever it may be. So that's so I always use licensed photos. So I have the license to that photo. There's different licensing arrangements on stock photo. The cheapest one's probably $29.99 a month. I think that grants you 10 licenses. So you could use any 10 photos within that month. And once you purchase those, once you have that license, that photo is yours to use on printed materials, publications, banner ads, whatever it may be. So always license your photos. For social media images, I like to use Canva because it's the easiest and fastest thing to use. I post every day on social media for our organization. And I know that may not be realistic to a lot of people, but you know, sometimes like posting on a Monday, Wednesday, Friday, whatever schedule allows you to, but Canva is a quick way to create an image because they have a lot of preset templates that you could just customize, put the language you in, lay over a photo, and you're set to go. So Canva, I would do a whole tutorial on Canva, but we don't have time for that. But there's lots of tutorials online. I honestly just played around with it, kind of just like see what I liked and kind of just, you know, it got creative. And that's one thing that organizations are able to do is kind of be creative because you have the free range and not like a public health department has, where they have a lot of like people involved. At an organization, you're kind of able to kind of play around with it. I always say, please forgive me for this, but I always ask for forgiveness versus permission. So I always just do things as I do it. And then if I get in trouble for it, then so be it. Usually I haven't really got in trouble yet. So another two applications I use are Photoshop and Adobe Illustrator. Now, these are things that I would like to use for like a more polished publication, like a flyer for an image that I'm going to be distributing. I think they're just higher quality. It just takes a little more time and effort to create those images, but they're a lot more customizable. Where Canva, there are a lot of preset stuff. So if it's something that you need to do really quickly, that's kind of my go-to. If I have a little bit more time, and if I'm creating an actual campaign that's going to go into a magazine or publication, I'll use Photoshop or Adobe Illustrator. All right, so now we're going to go into the use of the live events, and then I'll go into the influencer marketing. Sorry, they're kind of out of order, but I'll do this one. So live events, Facebook and Instagram live events let you live stream performances, gatherings. Viewers can be done from your phone, computer, or device. Reactions, shares, comments, and other interactive features enable you to engage your audience. So this is, I think, during the pandemic, especially a lot of people moved to this model. I saw a lot of Instagram lives that were very successful and some that were not so successful. And so some of the things that I would like to highlight is how to make a successful live event. So here's some tips. So first of all, you need to promote your live events. I know people just go live randomly and that's all they do, but I always like to promote the live event at least 1 week prior to the event happening. And that could be Instagram post images, tweets, Facebook posts, newsletters, and then email blasts. And then really be conscious about who your audience is going to go to. So let's say you have a provider that you're going to be having a discussion with, and you want other providers to join in on that live conversation. I wouldn't necessarily be posting this on Instagram because it's not really the population. I would probably do an email blast to all the providers that you have. Hey, please join us on this time, this specific date for this Instagram live discussion. And what's great is that you could I'm going to move down a little bit, interact with your audience during that live event. There could be a chat box, kind of like Zoom, but this is like on the live platform that anyone could just join in and see. So really monitor that chat and kind of interact with the audience as the live is going. Also, before that, create an outline of your talking points. It doesn't have to be scripted. Like right now, I'm just kind of like going off the slides. I don't have anything scripted. But the thing is, I do have my talking points and kind of create an outline and just be aware that sometimes the conversation might lead you somewhere else, and be very open to that, because that's the whole point of that is like, you know, you have the outline, but, you know, sometimes you're not going to go always, you're going to go off script a little bit. All right, so the next we're going to go into the use of influencer marketing. So influencers, unlike celebrities, they can be anywhere. Literally anyone can be an influencer. They can be anyone. What makes them influential is their large number of following on a particular social media platform. An influencer could be a drag queen, a popular Instagram model, a trans activist blogger, or even like a respected sex worker within their own community. Within any industry, there are influential people. You just have to find them. That's the hard part. Some people have hundreds of thousands, if not millions of followers, but a lot of them may seem like normal people. Some may have 10,000 followers or less in some cases, but yet they have developed a reputation of being experts in their field. So they are the go-to people that provide answers to people's questions. So it could be a beauty blogger, a drag queen that does performances on live, or do like makeup tutorials. These are the kind of influencers that you may not necessarily think of prevention work, but utilize those influencers to amplify the message and kind of bridge that gap between your organization and their platform, because those are the clients that you want to see. All right. And then, so how to collaborate with organizations? When collaborating with organization, influencers or micro-influencers, it's essential to have a clear purpose in the collaboration. So let's say you want to have, let's say you want to do an Instagram live with someone, or you want them to just post a picture. Let's say you got new t-shirts made and you just kind of want to do like a t-shirt campaign with different people. So you just have to have a clear purpose established. A proposal must be set in correlation with the collaboration launch. In the proposal, introduce yourself, why you want to collaborate with that individual, and how it would benefit both parties. When inviting an entity to a collaborative, I think just be mindful of the time frame of how long that collaboration is going to be executed. Excuse me. All right, so here's an example of kind of like a letter I use for like or if I don't know them personally, if I just want to reach out to them. So obviously one of my go-tos are the Lil Nas X. One day I will get him. Hasn't happened yet. But here's a letter that I sent his management team. Hello, my name is Manny Moore. I'm a social media coordinator for Radiant Health Centers. I'm contacting you today because I believe your platform as a gay Black artist would create momentum around the discussion of HIV/AIDS. Not only will this elevate the topic of discussion, but it will serve as a way for you to connect with your core community. I'm asking you to participate in a Facebook Live on February 29th, 2022 at 7 p.m. Eastern Standard Time as our special guest. As well as participating in a live event, please share the live link and registration on your Instagram story and Twitter feed leading to the event. Please see the attachment, signed and dated. So this is kind of an example of how to reach out to influencers that you may not necessarily know. It's really good to kind of keep an eye out. I know within every community has an influencer, especially let's just say, for an example, like in the Portland area, there might be that drag queen that everyone knows, or that bartender that everyone knows, that is that go-to person, or that, the barista that's, that is very popular. There's always going to be those influential people. So you just have to really find them that would best fit not only your organization, and by fitting, I mean that you could train to amplify the messages that you want to, because they're not going to know about HIV prevention work, but they're moldable, they want to learn and really collaborate with them. And it is a collaboration. It's not you telling them what to say. It's really using their platform and collaborating with them to create messaging around the work that you're doing. So here's some examples of stuff that I did here in Orange County. I think Drag Race, I think everyone, especially in Orange County, everyone loves the Drag Race, RuPaul's Drag Race. So what I did is I hosted weekly sex talks with contestants from RuPaul's Drag Race. We talked about sex, relationships, and it wasn't, so HIV and HIV prevention wasn't the focus, but it was definitely intertwined within that conversation. So we called it the Lockdown Lowdown Sex Talk. This was happening during the pandemic when everyone was in lockdown. So I had a range of special guests from Kimora Black to Laganja Stranja to Jessica Wilde. So I did some Spanglish editions as well as some just English editions as well. And we talked about from a range of topics about their time on the road, about their kind of like, it was like an X-rated version. And it was a fun way to engage our audience. I didn't make a slide for this, but I kind of go off the 4 E's models, which is engage, enlighten, entertain, but also educate your audience. And this was like kind of the entertaining factor of it. You know, who doesn't like a drag queen? I know I like drag queens. So, and a lot of my the audience members and clients like drag queens. So these were really well-attended events. I know if I just did an Instagram live on my own, it would probably just get 100 followers or 100 views. These each had thousands of views because what I used, because they were on their platform and they saw that they were going live. So a lot of their people that I would have normally reached on my platform, I was using their platform to build that audience to amplify the messages around HIV prevention. So I think my most successful live event, we had like during one live, we had like 5,000 views concurrently. So it was really hard, man, monitoring the chat as well as engaging. So one thing I would say is when you're doing live events, and I should have included this in the last slide, is really have someone, to have someone with you either virtually monitoring the chats and kind of like shooting you questions. Because it is a live event, it needs to be interactive with your audience. So kind of like take some time, read some of the comments and kind of shoot out questions. Now, one way to also engage your audience is prior to the event. So prior to the event, I also did kind of like, while promoting the event, like, hey, I'm gonna have Gia Gunn come on live next week. What questions should I ask her? So that would be kind of gearing towards that conversation. Like, oh my God, Gia's gonna be talking about sex, and kind of like her experiences as a trans woman. So a lot of people, we had most of the great questions were from your audience members. So kind of really post the questions of who you're gonna have beforehand and kind of like engage the audience prior to the actual event. All right, next slide. All right, so all this is good, right? We're doing cool stuff online, everything's fun, everything's easy peasy, you know, we're making cool content, but how do you gauge if that content is actually working? So here's some social media metrics. So social media metrics is the use of data to gauge the impact of social media activity on an organization's platform. So here's some things that you'll always see on social media engagement. And I think you should all have like business accounts so you can actually see these analytics. I think they're from personal accounts. Obviously, a lot of these analytics they're not the same. So one thing that you'll see is a reach. So your reach is the number of people who are seeing your posts. Higher the engagement, the better. Reach reflects the overall ability to connect with an existing audience or a new broader one. Your follower rate. So monitor your growth or decline on your social media pages are the clearest idea of how well your page is doing. So obviously, if you're seeing an increase in followers, you're doing something well. Let's say you're seeing a decrease in followers, maybe you have to adjust your social media strategies. Also your engagement. So your engagement includes the average likes, shares, comments, as well as things like your amplification rate. And I'll go over that in a little bit. So that's a number of shares, but we'll go ahead and do all that math later. And then also your demographics. So the use of your audience demographic is to inform and evaluate your target audience. Are there patterns that can work for a larger audience? So you have to really evaluate who is viewing your content. And is that the audience you want to reach? So let's say you have like 75% women as your audience. Let's say you want to reach your target, your population that you're serving is, let's say it's like you're trying to outreach to gay and bisexual men who have sex with men. You know, maybe you should adjust your social media strategies to kind of build that audience up. So you always have to take a look at your demographic of who is seeing your social media posts. excuse me, my voice is, so some Facebook metrics. So the impression. So an impression is a metric counting to how many times your post has been screened. Your click links, obviously, how many clicks an audience member took on a particular post. Let's say that took them outside of Facebook. So let's say you had a call to action to visit your website or a donation page or register for an event. So that gives you an accurate count of how many times that link was clicked on. Also, your engagement, excuse me, the amount of people who comment, reacted, or shared your post. And then I'll go your distribution score. This tells you how well your post is performing compared to your other posts. So it kind of gives you like a level. So sometimes like, I know I've done this where like, oh my God, this content's gonna do so good. It looks amazing. I'm so proud of it. And then I post it and then it's crickets. So kind of like having to engage that. So you'll kind of see a trend in what people like to see and what people don't like to see and what people are engaging with and what people aren't engaging with. And then your reach is the number of people who saw your content at least once. So the reach is different than impressions because the impressions are multiple views. Sorry, there's a typo there. Multiple views versus the reach is just one person. So that's the difference in the two. Impressions are the times people. So I could make the impressions by viewing my content more than once, but the reach is really the number of people that have seen your post. All right, so the Instagram metrics are almost the same. They're the same company, but it's a little different. So your follower count, obviously, you want to increase your follower count. Suppose you get 60 new followers in 1 month. If you started with 600 followers, and you get 60 new followers, then your engagement rate was 10%. So that's a great increase in growth. But let's say you have 6,000 followers and you have the same amount of followers coming in, your engagement rate is 1%. So obviously the more followers you have, the harder to get that growth is. And sometimes it's very fast. So one way to engage, to get your engagement rate is the following. So the total number of likes and comments during a specific period of time, then divide that by the number of followers you have during that specific time. So for an example, if it's September, you have 100 likes and comments among all your posts for that month, then you divide that with the number of followers you have. Let's say it's 650. Then you have an engagement rate of 6.5%, which is a great engagement rate. Most engagement rates are around 2%. So not everyone's going to interact with your post. They're going to see it, but not necessarily interact with that post. And then also, just like in Facebook, a reach tells you the total number of people who have seen your post. All right, one way to get traction in increasing your engagement is targeting ads. Ads are a large part of the success of an Instagram post, especially with nonprofits, for a nonprofit. When you turn a post into an ad, it will show up on a relative, an audience member's page who's not following you, but in the market to follow you. So Instagram and Facebook are very, very smart in their algorithms and kind of suggest recommended targeted audiences for you. And all you have to do is make great quality and then use that as an ad. I know you could specifically tailor an ad. I've done that many times, but Facebook and Instagram have gotten really good at suggesting your targeted ads for you. And that's one way to really increase your follower count, because they're going to see that post and maybe not necessarily engage with it right away. But if it's an ad, they're going to continue to see that. Let's say you're advertising some at-home mail order kits or a new prep program that you're rolling out. Excuse me. They might not interact with it right away, but they will interact with it eventually. The ads, kind of seeing that constantly. They're gonna want to do some kind of call to action eventually. This is a great way to increase your follower count and engagement with targeted ads. So social media metrics are very simple. So likes and shares, page growth, calls to action by an audience member, and then audience mentions. So some of these images are some events that we've had. We rolled out an HIV prevention, a drive-through testing during the pandemic. We were in the press with that. We did live events, but like we did a lot of drive-in events. So we did a screening for Selena, and then we did kind of some beach outreach events. But these are kind of like in-person events, and then but we use social media strategies to get those in-person events launched out. Excuse me. How are you on time? Okay, I'm just looking at the time. Okay. Sorry if I'm talking really fast. I just want to get through all the slides.
You're fine.
Okay. All right. So one way, besides social media strategies that we did like on Facebook and Instagram, we use the use of geolocating dating sites for digital outreach as well. So digital outreach is all encompassing. I think everyone lives on the digital realm in some capacity, whether it's on Facebook or Instagram. And the use of dating sites is growing in number of scope every day. Many dating sites are used to form relationships and often connect sexually. Dating sites are prime locations for direct outreach with the LGBTQ. I feel like I'm having a Justin Trudeau moment. LGBTQ plus youth population. Some benefits of the use of geolocating dating hookup sites. Many youth frequent the dating sites who are actively looking or engaging in sex. These sites offer prime locations for targeted social marketing ads. I know I posted a lot of ads on here that have gone traction, it's a great way to outreach for specific populations. These sites offer the increased likelihood of one-to-one engagements and referrals. Not only do we do ads, but we do, I actually have a profile on there as well to actually actively engage with an audience member. So here are some of this is like kind of here's my profile picture. You can't kind of really see it, but kind of like this is a language. Obviously it's very short, very generic. I'm not using like clinical terms. But these are some monitoring things that you could do at an organization's level. On an organization level, this is kind of some of the data that I like to use and get from a conversation, because everything's about, if the encounter didn't happen, did it really happen? So it's really documenting the actual encounter. So first of all, what site am I using? Whether it could be Grindr, Scruff, whatever it may be. What was the date and time of the encounter? What was the age? It could be anonymous. It could be an age range. So you're kind of just giving a guesstimate, I believe. What was the rate? These are some of the data points that I collect while doing engagements. The race or ethnicity, if given, the sexual orientation. Some people may not identify as, gay or bisexual. They could be closeted. They could just be, a straight man engaging in gay sex. Their HIV status, if possible. I've connected a lot of individuals to care. They knew their status, but they were out of care. And then any additional risk factors. Sometimes it can be hard monitoring these sites, especially because it's the anonymity involved in those sites. But kind of seeing, that's why I like kind of just logging on and just leaving it open. And then kind of just seeing that like comfortable face. I know a lot of people are, on constantly. So constantly seeing an image, like kind of get the strength to like ask a question. And that's how the conversation starts. Just having a presence on these sites is instrumental. I've linked so many different clients to, our prevention, our clinic, to different referrals, to mental health sites. Like, people use Grindr for a lot of things, but one way is to connect individuals to our organization's services. All right, and sorry, I was trying to race through that. I think I'm good at time. I know we have two other presenters, so I want to be mindful of their time as well.
You did great, and we're actually still good at time, and we still have time for questions. Thank you so much, Manny, for giving everyone your expertise on social media influencers and but the long title of this webinar. Joseph, do you want to take the Q&A if there's any?
Yeah, definitely. And yeah, thank you so much, Manny. That was so helpful. I had a couple comments during, there's none in the chat box at this time, but I do want to open the floor for any questions. So please, if anyone has, this is a great time. If you want to put it in the chat box, I can read it out loud. But I was going to ask Manny, have you ever done the influencer like hand, like where you put your hand behind a product and just like
I
show it
haven't
off?
done that, but I have held products up like this.
Okay, that's a
But
good
I
one.
haven't done the hand
Yeah.
thing. I think that's more makeup. I don't do the makeup stuff.
Okay.
But I have done skincare.
I can see us doing that with an HIV test, just like pulling it
Actually,
out.
well, one thing I would say is I actually use a lot of our drag queens, and I wanted to include videos in here of drag queens like driving up to get an HIV test. It's a really fun, innovative way. Like I love using drag queens. Not only do I have a personal connection to a lot of them, but I just think they just bring a fun element to HIV prevention work. Like I said, like the 4 E's: engage, entertain, enlighten, but also educate. And I think by bringing something fun like a drag queen, that brings the entertainment factor. So kind of like one of the video shoots that we did is I had a drag queen come honk. And then I would just run out and then just kind of like, it was just a cute little video that kind of went not viral, but like within the community, everyone kind of shared it. It was really fun to watch.
Oh, I would love that. There's so much creativity. And I think that's what I really got from your presentation is there's just a lot of different ways you can engage with folks and different audiences and the influencers' own like following. I could almost see like a Sonic sort of, the drive-through, but with HIV prevention, have the drag queens roller skate in. And just
we have had roller skating events as well. So I know Javier he was my supervisor at the time when we had a roller skating event, but we actually used a lot of, social media strategies to promote that event. We used drag queens during the event, but also the lead up to the event as well. So it's how we're promoting those events, in person when we could have them again. And kind of, using the social, because now it's in tandem. You have to have a social media strategy if you want to have an in-person event. And sometimes social media events are probably going to be doing well because that's another platform, and that's where people are living at right now, is on social media.
Do we have anybody any questions? Please feel free to unmute yourselves. Manny, would you like to share your handles with us for people to follow Radiant Health Centers?
So I manage the client-centered page. We have I think like also with pages, like there's that balance act. Like we have donors, we have clients. So I think even separating the two pages might be beneficial as well, because sometimes like your audience is not your social media audience isn't necessarily the audience that you're trying to engage with. So what we did is at Radiant Health Centers is we created two different pages: a more client-centric page that promotes sexual health and wellness, but we also have the overall encompassing page that promotes all our programs as well as donors and asking for donations. So our client-centric page is Be Radiant OC, at Be Radiant OC. And then I can be found on Instagram as well at Mr. Manny with 2 S's, Mr. Manny at Mr. Manny on Instagram and social media handles.
Awesome. Thank you so much. Since we don't have any questions, I'm going to ask a question because I think it'd be very helpful for a lot of the management and the folks that we have on the call. I was your supervisor and we worked together, but in a sense, outside of being an activist and being a very, very visible person in the community that engaged in the community, how was it for you stepping into a role of like public health and HIV prevention when there wasn't a background? And how do we as people that are hiring people onto these roles engage with someone and get them on board to familiarize themselves with outreaching to their own community?
So one thing I would say about that is everyone has a passion to do something and create an impact in their communities, whether that may be, and really identifying the gatekeepers within those communities and really developing them into someone that you would like to do prevention work. So I didn't come from a prevention background, but I was involved in my community and I kind of just fell into it, honestly. Like I just liked I liked what I was seeing, and I kind of just fell into it and I fell in love with it. But really identifying the gatekeepers within those communities and using them to not only train and mold, but also really amplify the messages that your organization would like to put out. Really identifying key people within the community to be those gatekeepers that have that audience, that have that notoriety. Maybe not like they're not going to be famous, but they are listened to by their community members, and really engaging those people. And those are the people that you want to use in influencers marketing as well. You know, they may not have 1 million followers, but the followers that they do have, they will engage with your organization. And that's kind of how I fell into HIV prevention work. I don't have I don't have a public health background, but I was very involved in my community, and that's kind of how I got involved with this kind of work. And now I'm still here.
Thank you. Any other questions that we might have?
I have a question. Oh, go ahead.
Oh, here, I'll just show my camera. Hi, Manny, first of all, thank you so much. To everyone, my name is Axel Ramirez Alcaraz. I am the Bilingual Benefits Navigator at Cascades Project. And I have a question for you, Manny. When it comes to like wanting to like help out like with these types of events and like bring them into like club settings, how were you able to like maneuver that? Because that is something that I definitely want to do here in Oregon, where like I really want to implement like testing or like talking about PrEP or like insurance like navigation and all that good stuff. But I also want to bring it into the club setting that makes it feel very like welcoming and not feel so like, to make it feel so informal instead of formal, and not making it so like, oh, like here, get tested, but like don't be scared, if that makes sense.
Yeah, no, completely understand. And that's one thing that we do here in Orange County, is that we actually do a lot of club outreach events, but we collaborate with the actual clubs itself and throw events there. We had a big Orange County Pride party that we put on basically at one of the local clubs here, where we had Adore Delano. She's a RuPaul's Drag Race queen. So she, was the host of the event. But like prior to the event, we incorporated HIV prevention into the entire event, whether it's posters, condoms on the tables, and we had testing tents. We had like 3 testing tents outside. So while people were in line to get into the club, people were engaging with us. We also incentivized testing as well. So let's say the line was very long, so we had a lot of time to outreach. So if someone got tested, you're like, oh, hey, you want to cut the line? Get tested. We get you in the front of the line and get you in the club. So really incorporating the club, it's a collaboration. You can't do this by yourself. So whatever the club wants to do, like let's say you want to offer like a drink ticket or something, a drink from the bar, which I know some organizations can't offer alcohol, but something from the bar, it could be a water bottle or something like that, or a meet and greet ticket, or a ticket to a future event, or just paying an entrance. Like those are some ways we incorporated that testing component into club outreach. But also the lead up to the event, like we did, I know Adore did a video for us, like just getting tested, just incorporating it throughout the event. And even like the small reminders of people like, hey, we have testing tents outside, get your, know your status. Like just that messaging is going to be incorporated throughout the club night, but it's in an inviting way. It's not invasive. I think a lot of people don't want to go to the clinic. So people didn't really seek that service when thinking about going out. But since that service was there, people do engage with it. I hope that answered your question.
It did. Thank you so much. I really appreciate it.
No problem. And then I saw a Grindr question. Where'd it go? Where's my chat?
Someone want to read it?
Yeah, can you? Okay.
Yeah, definitely. I think Alicia was going to ask it as well, but it looks like Eurydice asked, they're unfamiliar with Grindr. And apparently your profile was a personal profile or a business profile.
So
Yeah, there's some privacy settings and,
yeah, so there, so that one is, so I do have a work cell phone and I did it, it's not a business profile. Some sites do have health educator profiles. Unfortunately, Grindr does not have that. So it was made on a personal, like it's like a personal profile. It's not it's like not a business account, but it is a business account for me. I only use that profile for work. It's on my work phone. It lives on my work phone. Some people may be comfortable using their own photo. Some may be a stock photo. It could be a picture of an HIV test kit. I've seen a lot of my colleagues use different photos as well. So it really depends on what your organization's policies and procedures would be. And that's kind of something that could be developed internally. You could get the account technically banned, but like I said, like ask for forgiveness, not permission. You could just easily make a new one. So it's just like, I unfortunately, like, luckily nothing has happened where, someone, flagged that account. But it is technically a personal account, but it lives on my work phone and it's a work, I use it only for work. So everything's documented with it was on the slide deck of what the information I do like to gather during the information. And if a referral was made to an organization, actually I've made several appointments just using Grindr to our clinic. So they would come in, everything was done via Grindr Messenger, but they left away with that, with a clinic appointment and then a PrEP prescription. I hope that
Awesome.
answered that question.
Yeah, I think you did. I just want to share a couple of our partners here in Oregon also use it for case investigation. They've had success reaching out to folks, promoting local outreach testing events. So yeah, I think what you suggested is really helpful, like an internal policy to navigate what works for each organization. Javier, yeah, go on, sorry.
Almost the same question. Just wondering about how you collect the race, ethnicity, and the other data. Was through the app, or you like taking that data?
So a lot of the sometimes the demographic information is listed on their profile. So sometimes it's unlisted. So sometimes that data collection is incomplete. But a lot of them do put that information in there, like their age. A lot of them put Latino, and some people put like Black. So you do get a race. There is a race component into that app built in onto their profile. And then I'm not going down the list asking these questions. It's kind of what I see on the profile, and then how that engagement transpires is that's where I'm like collecting information. It could be like, oh, hey, I'm HIV positive. Okay, so I check that box off. I'm seeking, and it could be subtle hints like, hey, I'm looking for a new doctor for this thing. Do you have any recommendations? And so by putting those pieces together, you're kind of gathering that information as that conversation is happening. You're not necessarily asking them like, what's your age? You're not doing a questionnaire via the app, but you're gathering the information that you do see. And so some of it might be incomplete.
Thanks.
All
right, I think we're at time, but do you have a question, Alicia?
Yes, that's why my hand is raised.
I have many screens.
It was just like, quick question. So when you are doing outreach via social media and you are tracking like how many reaches you have or impressions or how many people are seeing it, how are you measuring success like for the actual like testing event or something? So like say you have 600 people who have like seen your event or they've liked it. Are you also counting like how many people are showing up, or how do you measure?
Yeah, so that's kind of like the difficult part is like social media engagement may not necessarily resonate into an actual clinic appointment or the amount of tests or like mail order kits. I know it's hard to measure. That's one thing that's kind of difficult to measure, and you can measure your successes in different ways. I know when we did when a porn star met utilized our service, and kind of we got connected that way, and then started posting about our service, my phone was blowing up, honestly. I got so many mail order kits. I sent out maybe 100 that week, just mail order HIV test kits. So it really depends on let's say for this post, I want at least one new client, or, it's really, it's very internalized. It's how and it's kind of hard to gauge. I can't give you a specific answer because, your engagement looks good online. Let's say you have a great engagement rate, but no one's really seeking that service. One thing I would say is if you have links, like a clickable link to a site, or an appointment site, or like a phone number, that does engage. You could engage it. You could see your engagement rate that way as well. So many people clicked on this phone number, and so many people made that phone number call. And then whether that call, you don't know if that call came from social media. Actually, you can get that analytics. I know on Grindr, they give you those analytics as well, if you do a banner pop-up ad. But it's really internalized, and you kind of have to gauge that on an organizational level. So I can't give you a solid answer for that one.
Awesome. Thank you so much, Manny. We really appreciate it. And if it's okay, we can share out your contact information.
Yeah, definitely. I think there's a contact page on the screen as well. So feel free to contact me if you have any additional questions.
Perfect. So everyone screenshot this and hit up Manny for some more tips. And once again, thanks, Manny, so much. We're going to go ahead and start our next presentation. Awesome. Javier.
Yes, thank you so much, Manny. You're welcome to stay. If not, if there's other questions that roll by that we will follow up with you and see or connect you with other folks. But again, thank you so much for presenting today. For our next presentation, we have, actually, Joseph, are you going to present? Rama?
Yeah, we have Rama on the call, and just a little brief bio on Rama. She works at Whitman Walker, and she has been in that position since September 2013 as a health educator in the community health department, and currently as the senior manager of community health. And so in addition to working at Whitman Walker Health, they've worked as a commissioner on the Planning Commission of Health and HIV. So they bring with them a lot of experience, and we're really excited to hear from her today. Hello, Rama.
Hi, everyone.
Feel free to introduce yourself further if you'd like to. I know that a short bio never does it justice, but.
Oh, no, it's fine. That's perfect. I'm glad you curtailed it.
I had to shorten it just a little bit.
Yeah, I'm totally glad you did that. And that was great. That gets us to right where we need to be. I can see you, but I can't see myself. So can you all see me?
I can see you, yeah.
Okay, perfect. So yes, so as he mentioned, my name is Ramatullah Keita, but Rama is fine. So if my pronouns are she, her, and hers, and I've been working at Whitman Walker for a long time now within the community health department. So here I'll share with you a little bit about what COVID has brought to how we've digitized kind of the telehealth prevention aspect of the department, where Whitman Walker is, and a little bit about our social media strategies and prevention, and what's worked for us a little bit, and kind of just anecdotally share some stories with you all and answer some questions as they come in. So Whitman Walker is started off in 1973 as just a VD clinic made up of just volunteers, 7 volunteers in the space, just to really support in treating and finding spaces for folks who were diagnosed with HIV/AIDS. And now we've grown into the leading HIV/AIDS provider prevention providers in the greater Washington, D.C. area, in the DMV. You are from there, you will know DC, Maryland, and Virginia. So we work every day to fight the stigma against HIV and provide that support and care and linkage to care to our clients. And we've grown into a comprehensive health center. We provide and LGBTQIA health organization who really strives to ensure that we have an integrated model that focuses on the needs of each individual patient and client. So at every entry point, you should be able to access the care and support that you need. And that is our model, whether it's from social media, our community outreach, or a medical department. Every entry point should get you to where you need to. We have legal services, as you all can see here. We have dental, we have pharmacy, robust social media outreach program, and general outreach, which all lives in the department, community health, where I will talk about more extensively throughout this presentation. We have youth and family services and research, policy and advocacy, just to ensure that our model is integrated enough to just really meet clients where they are. So within the community health department, let's say this is some pre-COVID info here about what we do, and some post-COVID things where it has enhanced, which allowed us to enhance our services and increase access to our patient population. So we do on-site HIV testing, youth prevention, mobile outreach, wellness services, our mobile health initiative is deprived as a team, a cohort of folks who, along with a provider that brings that healthcare linkage to care in the community beyond testing, and you can get linked to care and start your treatments or your STI treatments, your HIV treatments right on site with the provider, whether it's accessing PrEP, whether it's accessing PEP, so all of that. So as you know, the pandemic curtailed those efforts as well, due to folks not being able to really access the community and us following the CDC guidelines of limiting those interactions at the moment, especially at the beginning of the pandemic, until we understood more about it and finding preventative ways. But that did not stop. Folks still needed our services, our STI services, our prevention services on this end. So we found a model to ensure that we were still providing that care and access to our populations with, so we started social media outreach. Social media outreach was a program that was started right before the pandemic. I think January 2020 is when we implemented our social media outreach. Little did we know by March 2021, it would be our greatest outreach effort to ensure that we were still present and provide that visibility and access to care to our clients. So let's prep for prevention a little bit. Some of the things we'll talk about some telehealth services that we started and for our priority population. Just a heads up, as the previous presenter mentioned, it's really important to ensure that you know your priority population, whether in-person reach, or social media reach, or outreach. It's really important to know the key populations that you're focused on and you're trying to reach. And these are just some of our populations that we focus on, especially that a lot of our programs are grant funded. So these are the populations that are most vulnerable to HIV. And in addition to focusing on social determinants of health, and historically, these are the populations that are at a disadvantage than our Caucasian counterparts. So it's really important to ensure that we understand our populations and who we're trying to reach, why we're trying to reach them, and understanding social determinants of health, and focusing on the equity and visibility within those communities, and removing those barriers that's frequently seen in those communities. And those communities also serve as our influencers. We'll get more into that. So because testing, folks were still, although there was a pandemic, folks still needed access to our testing services, our counseling services, our linkage to care services. So we turned our services into a at-home HIV testing pilot that we did for our most vulnerable wards, which are Ward 5, 7, and 8 in DC, where HIV is most prevalent in those communities. So counselors, this kind of just tells you about the program that we had. We did audio appointments to ensure that we were meeting folks where they are. And these folks they're using their phones, they're using their computers, their internet access. which was also vital to ensure that folks had access to these things, and doing wellness checks to make sure that we're doing those at-home test kits with them, and really still providing them with that one-on-one interaction that they're used to when coming to get testing. And so these programs, we've digitized our our at-home based testing programs during the pandemic, and during the pilot program it was successful. Folks were interested, but there was still something missing. More so, how do we still reach folks? We can call them, but how do folks know that we're still here for them, and how can they still access us because we're no longer physically in the community? So this is just some findings of the data. A lot of folks did self-report back, and because we didn't really, a lot of folks who implemented this at-home HIV testing a lot of other organizations reported folks not reporting data back. And something that we did to mitigate that was that counselors were on the phone and going through the HIV prevention counseling with the clients as they would, as I mentioned in the last slide. So we had a lot of folks linked to CARES at Women Walker and taught folks how to use the telehealth platform. And in that space, we were able to tell folks that point them onto our social media platforms where they can still reach us for contacts and connect as they would in our outreach event. Because our outreach events, we had a various amount of hours, really met the community where they are. It wasn't a 9 to 5, so our social media outreach platform also reflected the services that we already had, so the baseline. I kind of talked about this already, handoff supports. Clients receiving them, they were still longing for our walk-in services, but they were appreciative of us being in the space. So again, from this project, we were kind of, we know that we needed more visibility of Whitman Walker and our community health department and outreach efforts. So we tailored all of this to build into our social media content and building our social media platforms, which we're getting to soon. We can skip this one. What I already talked about. So we have so PrEP, as we all know, PrEP is a large component of prevention. So HIV prevention. So it's extremely important that we continued our PrEP clinic that we developed, which is also an in-person clinic designed to, remove the barriers of folks doing having to come to see the provider to access their PrEP. So promoting that we had a telehealth PrEP clinic was extremely important for us. So creating these flyers that reflect, simple, easy, digestible information so folks knows that it's a simple process. So our PrEP clinic now, a very successful PrEP clinic in-person service that we had for folks had now shifted to a telehealth and digital platform. So promoting that to our cohort was extremely important. So in March 2020, we canceled all of our in-person appointments. We transitioned to our telehealth models. We provided 30-day virtual checks to folks. We implemented a teleprep. So understanding that had to be promoted too in our social media efforts. So wellness checks and calling folks, it wasn't enough. So ensuring that folks that they could still access their medication and their prevention efforts, we would still continue that through telehealth. Because a lot of our clientele were not familiar with telehealth because telehealth wasn't a practice that Whitman Walker did. We actually switched our centers into COVID response centers for our more vulnerable populations. And then all of our other services moved to telehealth. Again, the promotion of that in the space of COVID-19, we knew that social media was our only way to reach our populations. So this just kind of shows you the numbers of our COVID positivity rate, pre-COVID during our new PrEP prescriptions, and then PrEP prescription. Do we answer questions in the moment, or should we answer questions at the end?
We can answer at the end, but
okay, sounds good.
Awesome.
Okay. So this kind of just shows you our PrEP prescriptions pre-COVID and post-COVID. Again, heavily based on folks not really adjusting to the telehealth model, not understanding that the same level of service and care were at their fingertip now. And a lot of folks also in our populations are folks who are displaced, do not have access to mobile access. So figuring out how to deliver those test kits, how to deliver the information. So we also, in the space of through social media, we understood the needs of a lot of our clients, where family members will log on and connect with us to let us know that someone, like a patient, in their home who does not have access to a cellular device or access to internet or access to telehealth, but they really needed an at-home test kit, or they needed to make their prescription. So in those cases, we started developing ways to ensure that folks got that that delivery to their homes, delivery and access to the test kits, doing an Uber kind of situation, and like a handoff, a warm handoff and delivery to the door-to-door access. And so folks, those, as you can see, numbers from March and April, they've risen post-COVID, so that folks can see, and our positivity rate for COVID-19 also declined significantly as we learn more about COVID-19. This is more of the engagement outcomes. So implementing the telehealth was overall a success for folks. This is just kind of what it tells you. Folks who were disenrolled, a lot of folks were still at home, just switched to having monogamous relationships versus and just really a decline in sexual activity for folks who have who actually disenrolled into from our PrEP program, but most folks remained and really appreciated the telehealth approach. So with that, with implementing those telehealth and the telehealth services that we had, we knew that, again, promoting that in our social media platform was extremely important, in ensuring that folks were still getting the amount of education that they've had before in our outreach programs, because we will have 4 outreach events a week at any various times. So from that, so there was a need in the community for our presence. So with our social media program, outreach, it was important that we picked community members who reflected the populations that we were looking for. As we know, information is received best from people who look like you, people who live like you, people who you can relate to. And as HIV prevention, HIV counseling, folks who worked in this space, we all know that implementing that peer-to-peer interventions, they work. So that's essentially what social media is. That's the approach that we took to our social media team, to ensure that these members were peers of our community peers, members of the LGBTQIA community. They have social media platforms that align with our mission, inclusive and diverse, not just diverse, extremely inclusive of folks' experiences, and using their platform to teach them, having a conversation that's interwoven into an educational component, but really focusing on relatable content that is that's important to that specific influencer, and always joining in with Whitman Walker and obviously bringing our materials similar to what the previous presenter said, and trained by our outreach team. Yes, they are not, these folks, our social media influencers, are not necessarily HIV prevention counselors or public health folks with a background in prevention. However, we do take the time to train them, and kind of, because they reflect the community that we are serving, that we're looking for. Oh, could you mind go back to the last slide? Oh, thank you. So to ensure that we are focused on them, they are trained to understand what appropriate inclusive language looks like, what and making sure that our content is bilingual, folks who are passionate about raising awareness around access to LGBTQIA healthcare services. And when it was extremely important to us, because during this time frame, it was there were a lot of social unrest and racial unrest in the community. So our diversity and inclusion efforts staying with current events was extremely important to us because healthcare is a whole person care. It's not specifically linking you, or you have social determinants of health are at the forefront of ensuring that someone's whole health needs are met. So ensuring that in addressing the BLM movement, addressing the uprising with comparing, like, the self-care content that we did, things that were extremely relatable, like seeing the person first, was extremely, and our motto at Women Walker is "We see you." So meeting folks where they are on social media is what really caused like the engagement, like taking newsworthy content that's relatable to folks and our influencers, giving them the space to be exactly who they are while still providing that educational component, understanding that your health is a holistic approach to it. So, and within that, we know that we are not the experts on everything. So therefore, we collaborate with organizations that aligned with our priority populations, trusted organizations, to collaborate and do lives with them and promote cross-promotional content, because everyone was on social media at this point. So it was, it made it that much easier to connect with organizations because everyone was looking to develop their programs that way. So really focusing on organizations that align with your organization's missions, and not simply for likes or follows or clicks. The engagement is important, but it will come organically if the content is also authentic to who the influencers are, to what the mission of these organizations are. So we wrote in our lives, a lot of our folks are also, we have lives in ASL, we have lives in Spanish, occasionally in English. So a lot of our content is tailored, again, our population. We keep our population in mind throughout every single content that we put out there, even if it's just a picture. And many of our infographics and outreach are all translated, and our content, we do our best to ensure that it is affirming and gender inclusive language. And of course, on social media, because you just never know, especially with the comments, you're not sure what's going to come in. So we built on the back end, we do have a glossary and a dictionary to ensure that we know like who's on the platform. We do have folks set aside to mitigate those controversial spaces that may take place in sessions and conversations that may take place during our social media outreach events. And our Instagram, again, visual representation is extremely important. And we partner with sororities, we partner with content creators who are extremely focused on our priority populations. We have series every single day. There's a series. We have a series that's dedicated to COVID combos, LGBTQIA spaces, just normalizing and removing the stigma around identity, gender identity, and Women Wednesdays focus on women's health, and a lot of community buy-in goes into the content that we make. We encourage, we do focus groups, we do trivia in our stories, we have a lot of consent conversation, Black women and HIV, everything dedicated to our priority population. They know there's a space for you to come there, especially our displaced folks too. And again, as I mentioned, like current events, it's extremely important to ensure that we're including current events so that we don't look like we are far removed from what's going on in society, how that's affecting folks' health and how they're presenting for health. It's extremely important to do that. And these are some of our influencers. So again, it's a lot about intentional hiring. These are folks who are in community, who identify with our priority populations. And we have our community health outreach team who are also members of the community. And that peer-to-peer approach and the representation is extremely important for us. So they also support the platform and they also have a following. So let's share our influencers. And this is just some of the content that we've built. Infographics are extremely important. If you go to the next slide. So for us, one of the most effective engagement tools has been infographics. So infographics, it demands the attentions of your audiences and encourages visitors to spend time on the site consuming the content that you're giving them. And 8 seconds is the average attention span, you know? So it's important to ensure to give folks organized information, digestible information that they can interact with and save and share. So a tool is, and we celebrate LGBTQIA holidays as an infographic, or visibility days, or STIs, or news, any kind of information that community members that we feel that they need in the public health realm, we make an infographic on it in addition to our live. So infographics are also a standard approach for our social media outlets, whether it's on Facebook, whether it's on Twitter, LinkedIn, Instagram, of course, to ensure that we do have those infographics lined up for folks. And it's a tool that has worked a lot because folks bookmark it, especially during in 2020, 2021, infographics became, companies have been using infographics since about 2014, but in 2020, infographics became the tool to use on social media, the way that folks receive their information. So we utilize that a lot. So, because we know not 93% of daily communication is non-verbal. So it's extremely, so the well-designed information definitely engages readers, and it allows them to share with their communities. And through the through our engagement and our metrics, we do see that our infographics get the shares, the likes, the engagement, the questions. They bring us the most questions. In addition to our lives, the infographics are a great, effective engagement tool. I recommend it for everyone. And this kind of shows our overall, it's from January 2020 to 2021, just some data where the growth has been. Our LinkedIn pages were the pages that, you know, a lot of folks are there. It's more so, you know, just in social media outreach, it's important to make sure that you diversify your information to your audiences. So folks on LinkedIn, everything that we share on Instagram, we won't share on LinkedIn, or we won't share on YouTube, or we won't share on Facebook. But Facebook and Instagram will collaborate in that way. And Twitter, folks digest information differently on LinkedIn and Twitter versus Instagram, Facebook, and YouTube. So it's really important to ensure that you do that. So our social media, like honing in on the information that we share on each platform, allowed for exponential growth of our social media platform overall. This is again showing you our growth versus January 2020 and the percentage of growth, and our new followers on Instagram. Instagram is the platform that folks, I would say our followers enjoy the most. So of course, what we're doing there is working. So we're definitely focused on our LinkedIn spaces, our Twitter spaces, and Facebook to kind of grow our following there more. And this shows you our diverse team, our team of social media folks who come to the space, our influencers, our community health outreach folks. And if you have any questions or comments, you can email me, and you can definitely go ahead and ask them now. And thank you.
Thank you, Rama. That's so helpful. And I really appreciate just a lot of the common themes that are coming up in today's webinar. And it's that collaboration piece for me, honestly. Like, it's not assuming that we're the experts, and it's building those connections with community members so that they themselves have input in how this is going to go out. So I really appreciate you talking about that. And who knew LinkedIn? I personally didn't know LinkedIn would be a place to spread HIV prevention messaging. So that's really cool. And then there's differences naturally between like what works some places and what works in other places. So we did have one question from Alicia. Did you continue telehealth options after your clinic reopened?
Yes. So it's important to ensure that, similar to the way when we provide prevention tools or risk reduction tools to folks, there's like an ABC model to it, or there's like, we give folks a buffet of options. And that's how, there's no linear way to do healthcare. So I think that that's what the social media has heightened that for us. We didn't have telehealth. So yes, we still kept those options for folks. Teleprep still exists. All telehealth services still exist, but we've learned that a lot of our clients really do appreciate that we're open and we're back in the community in a safer way. But people still use others. We are still very much in a pandemic. So people are still more comfortable being home and utilizing the telehealth services. So yes, they're still there.
Awesome, thank you. Do we have any other questions?
Hi, thank you. I'm gonna just ask another question because there are no others. I appreciate your presentation. I am curious about, like, did people still come in for labs? Like, they came in for their appropriate labs, like even during the telehealth visits? And like, was it ever, I guess I'm just sort of wondering, like, if there were any barriers with that, because people would have to come into the clinic for that. And yeah, you could just talk about that. That'd be helpful.
Sure. So we, what we did was we partnered with our LabCorp. So we've have in our, we're our about technically all LabCorp sites, you know, we provided some transportation support and services. So folks, the LabCorp is closest to your home. That's where you want. You did not have to come to the clinic if you didn't want to. So it was more so your intake and the visit with the provider, telehealth and things like that. But we collected lab specimens at our LabCorp facility.
All right, thank you. I appreciate that.
Sure.
Also, quick fact about LinkedIn. Right now, the two social media platforms that have the most organic reach is LinkedIn and TikTok, actually, without having to pay for it. So that's something, if you follow Gary Vee always talks about the media platforms with the most organic outreach. LinkedIn is a great one, especially if you're seeking to find young professionals or professionals in any field.
Thank you. And I definitely want to mention that TikTok this year is our go-to as well. People love videos and the creativity is just unmatched in that space.
Definitely, everyone should jump on and, you know, just look at it. You know, if you search PrEP, you search Truvada, you search, you know, kind of key terms, you'll get a lot of videos and a lot of folks. There's some folks doing great videos on Take Me Home. It'd be great to see some folks doing videos on the programs here in Oregon also. Just an idea
And
throwing it out there.
hashtags.
Yes, hashtags.
Hashtags are very important. Don't overwhelm your post, but hashtags are important.
Yeah, and a great tactic to doing that also is commenting on your own post after the post itself with the hashtags. That's something I learned from Manny. That's something Manny always does.
Awesome.
Yeah, I still do it actually. No, yeah, because it's yeah, it looks a lot of jumbled all in the first post, but in the comments, it still works the same way though.
All righty, well, if we don't have any other questions, or if you can think of something later, we definitely have Rama's information and then we can forward the message. If you want to stick around, welcome to stick around. Next presentation that we have, we'll move forward. Let me share my screen again.
I did have one question before we move on, Javier, just because I think we have a little time before our next one. But Rama, I was curious if you can speak to like how your PrEP, you know, how that program came about. We're interested here, or at least I've heard that we're trying to, you know, make PrEP more accessible, and we're trying to, you know, spread just all our PrEP navigators and just make this just a lot more streamlined, for lack of a better word. But could you speak to that, like how to start that process or some ideas for our partners? Yeah.
Definitely. I think it speaks to our intent to have an integrated healthcare model where our medical and our community health team and like our support services are integrated to make it easier and more accessible. So this was a collaboration between my department and the medical department, because we were going out, because doing the outreach, doing the HIV testing and counseling and doing the prevention conversations, but there wasn't a medical component in the space. What if someone was ready to transition unless the person was positive, right? So the linkage to care, so that's the status neutral approach, essentially. So to ensure that folks who are positive are getting linked right back into care, and folks who are negative are also getting into care, for the preventative look aspect of it and reach. So building the PrEP navigators, because these folks who are, because with your PrEP, you have to come every 3 months, right? So coming 3 months, there are providers, typically the clinic is closing at 5 o'clock, and that doesn't, folks are working during that time. But the PrEP clinic becomes it's a 20-minute entry point and exit point. So it takes 20 minutes to do your metabolic panel. So those in our EMR, those labs are standard, they're ordered already by a provider, and our community outreach specialists are trained phlebotomists in addition to them not just doing the 3rd generation rapid test. So those folks are trained. So developing the protocols of just the linkage of like the support if something, there's a provider that oversees the program in addition to our community efforts, like between Juan Carlos and I, which is the director of my department. So oversees that project too. So so that's so that we have PrEP navigators on the team who for insurance issues, but for the most part, these are established PrEP patients already. So on a yearly basis, they would see their medical provider, which CDC protocol calls for. But every 3 months, their follow-up visits comes with in 20 minutes, you just see it with the community health department and your PrEP specialist. And in that space, when folks seroconvert in that space, there is a provider on site also to support with that if anything happens. And those folks are followed up every 3 months. And before you schedule your appointment, before you leave, you already know when your next appointment is, when to come, and there are reminders and alerts sent out to each patient. There's an enrollment process, so we can talk through sharing some protocols and things like that when you all are ready, for sure. We'd be happy to share.
Awesome. Yeah, definitely. We'll share out your contact information if anyone wants those. And thank you just so much for your time today. It's been amazing. I know it's been really helpful for all our partners here today. So thank you, Roma.
Thank you for having me.
Yeah, of course. All right, Javier, as you were saying, we're transitioning to our next presentation. Here's Manny again, in case you missed him.
All right, we are back. Here we go. And last but not least, we have folks from Howard Brown Health, their online community engagements. They're presenting today. I have both Mario Higgs and Javier Chapa, and they're together. And would you give us an introduction, please?
Thank you, Javier. Hi, everyone. My name is Mario Higgs. I am the social media health educator here at Howard Brown Health. And I go by he, him, his pronouns or anything respectful.
Hey, everyone. Happy Friday. My name is Javier Chapa. My pronouns are they, them, theirs. I'm the at-home prevention health educator on the outreach team at Howard Brown Health. And we're both here today to present our work on online community engagement strategies and the outreach team. Cool. So before we jump into everything and go over our strategies and everything, just a brief little history about Howard Brown Health. Howard Brown Health was founded in 1974 here in Chicago, Illinois. It's the largest LGBTQ+ health organization in the Midwest. And Howard Brown's mission statement is Howard Brown exists to eliminate the disparities in the healthcare experienced by lesbian, gay, bisexual, and transgender people through research, education, and the provision of services that promote health and wellness. And we're established on 7 major programmatic divisions, which are primary medical care, behavioral health, research, HIV, STI prevention, youth services, elder services, and community initiatives. And Howard Brown Health has been rapidly expanding over the past 5 years. We started over on the north side, and all our locations are listed here. And over the past 5 years, we've just been rapidly expanding to reach new communities across the Chicagoland. On the right, you'll see a map there with all of our clinical locations, and you'll see a lot of them are up north, and recently a lot of locations have been opening up on the west and south sides, just so we can further reach more communities here in Chicago.
All right, thank you, Bobby. So a little bit of history about our online outreach program. So we started our online outreach program in 2018. And it has very expanded over the past 4 or 5 years. And so we've used geosocial apps, and this has allowed us to create a space in order to have clients come in for these services or anything that Howard Brown is offering. And so the online applications that we are using is like Grindr, Jack, Adam for Adam, Growler, Bareback, Facebook, Instagram, and even Google Ads. And so I'm going to probably go in a little bit more depth in those apps as we go on more in the presentation. Next slide. So these are some of the apps that we use currently here on the outreach team. Some of you all might have seen some of these apps, but specifically, I want to kind of just touch base on 3 main ones here, which is definitely Jack, Growler, and Bareback RT. And so Jack is one of our popular ones here that we utilize the most here on the outreach team. And we see to find a lot of people of color and people that we are serving in our community. And then also Growler. So Growler is another popular app that we are using here on the outreach team. And this is a community of people or users that identify themselves as like the bear community. And so we find this to be very popular as well. And then Bareback RT, we also use, and that is a community that is for people that are looking to hook up, that want to have unprotected sex or raw sex, essentially barebacking, right? So these are some of the apps that we currently use. And in the future, if you go to the next slide, as we know that outreach is always expanding, and so social media is always expanding as well. And so we would definitely want to, stay current and stay up to date with everything. So definitely in the future, we're definitely looking into different apps like Sniffies, Tammy, and Lex. And so Sniffies is basically a cruising app. This is an app for people that are looking to hook up, that are just randomly cruising, and they're just looking for a good time. Tammy is another dating website. It's kind of like Tinder in a way. So it kind of reflects that application. And then Lex, finally, is another hookup application or people that want to post ads. And it kind of reflects something like Craigslist. I don't know if people ever used Craigslist back in the past, but on Lex, you can definitely make posts, and it's more like a community, basically.
Awesome. So given all this information on the different types of geosocial apps that our team has been utilizing, let's dive a little bit into, what's the purpose of using social media? What are the benefits of utilizing this technology? First off, optimizing your visibility. By being online on these geosocial apps, you're just putting yourself in a visible position where other community members can see you, they can tap on your profile, they can see what you're all about and what you're offering. Furthermore, you're also able to target specific groups by utilizing these geosocial apps. As Mario was diving into earlier, Growler is one that's specific to men who identify as bears. Bareback is one where it's people who are looking for condomless sex. And then with Jack, it's people who are more often than usual people of color. So we're able to kind of target these specific groups by utilizing all of these different geosocial apps. And in addition to that, we're also able to target underserved communities, people who aren't receiving these resources. We're also able to target people who just simply aren't aware that these services even exist to begin with. And we're able to spread that information to them so that they're able to make the decisions on their sexual health that suit them best. In addition to targeting groups, we're able to also schedule posts and announcements to users in a selected location radius. So Growler, you're able to create Growler shouts where a message is released to the community in a radius that's designated like 10, 15, 20 miles. Bareback Real-Time also has the same sort of feature where you're able to post quick connect ads where it's a message that's spread, marketing whatever it is that you're offering. And in addition to all of these things, you're also able to just scout your area to find new potential clients for screenings, for education, or whatever your organization is supplying to your community. Over to the right, you'll see a screenshot of the Growler geosocial interface. And this is how you can kind of create a Growler shout and release that to a certain radius within your area. So given all that, now that we have a little understanding of the different sort of geosocial apps that are out there and some tactics for messaging and benefits of utilizing these geosocial apps, let's dive a little into how do you create your social media profile. And there's a few key steps in this that will make your geosocial app really effective. So first off, profile photo. That's the first thing you see when you're scrolling on the apps on the grid. You see all these, lovely faces who you're going to tap on, who you're going to, be peeking at. So you want to make sure you have a nice photo that's, like alluring. You're getting people interested in your page. We think it's really important that you use a clear picture of yourself or an agency logo that represents yourself, your agency, or your brand. Personally, on our team, we don't like using stock photos or photos of someone else other than people who are on our team. I know we're all familiar with that MTV show Catfishing, so you don't want your agency being the next culprit on Catfish. So make sure you just get a nice photo of you or your team or even just your brand logo. In addition to the profile photo, the bio is the next most important step. What is it that you're marketing to your community? So you want your bio to be something that's captivating and it's engaging to your audience. You want to clearly state the services that are being offered and how people can access them. In addition to that, you also just want to give background information like the service hours of operation and your team's contact information, like a phone number, email, wherever people can reach out to access these services that you're advertising. And lastly, it's really important that you link any of your other social media accounts to your geosocial app. So if your organization has a Facebook or an Instagram, a Twitter, etc., it's a really great opportunity to link that to your geosocial app so that clients can tap on that social media, they can check your credibility, and they can also follow your other social media platforms and stay engaged with your agency. And over here to the right side, you'll see two screen captures. These are the first two photos that we use in our geosocial apps. So the first one that you see, it clearly states we work at Howard Brown Health, let's chat. And then that's a photo of our beautiful team underneath. So you can see, you're talking to one of the people on this team. It puts a face to the profile. And next to that, you'll see the next slide says questions, inbox, health educator for more information. So kind of getting that conversation started. Inviting the people who are looking at our profile to ask us questions and kind of creating that safe space to talk about sex. Next slide, please. All right. So now that Javi has talked about, setting up the profile and the bios. So how do you engage with your audience online? And so by engaging with your audience, you basically want to message them or tap them. And so here on the outreach team, we use different tactics in order to try to engage users and in order to talk back to us, right? And so one way is by messaging users. So sometimes we just scroll through each profile. You can just literally cruise through each profile and literally that is showing visibility. And so the user would see like, oh, okay, somebody's like looked at my profile. Let me go see who viewed me. And so then that can like, gain attraction to your profile, and then they'll read your bio and say, oh, I might be interested in whatever you have to offer. Another way is by tapping users. So we here on the outreach team, we just tap and that just notifies the user that somebody has like poked them essentially, kind of like Facebook did back in the past. And so a user will get a notification that somebody on the other side has like, tapped them. And so then that also can bring visibility to your profile as well. And then, if you have like downtime within like your program or whatever you're doing, you can just try to like utilize your downtime by just messaging users just up front. So just going to each user and saying, hey, my name is Mario Hayes and I'm with Howard Brown Health and we're in the area today offering free screenings. Let me know if you're interested. And then, go from the conversation by there. Some people will say yes, some people will say no. And you'll be shocked a lot about like how many people actually say yes to what you have to offer.
And then also you'll get unsolicited messages. So you will definitely get people that are trying to hit up on you, trying to get your number, you know, you're looking good today, you know. And yes, the compliments are cute, but you still want to keep it professional. And so you can definitely deflect that conversation by saying, you know, hey, I'm working with Howard Brown or whatever organization that you're with, and I'm online only talking about sexual health or screenings today or services today. And would you like to learn more? And that leaves an open-ended question for them to say yes or no, and say, you know, oh yes, actually, so and so, or no, not today. And then you can go from there. And so here on the side, on the right-hand side, we have a picture of an example of a client on Growler, actually. And this client is interested about PrEP. And so we have a health educator just responding back to that message and just giving them resources and to navigate them and connect them to PrEP. Next slide. Okay. So we talked about messaging, we talked about tapping. So then you can also advertise your services in a large, massive message to a large number of people at one time. And so you can do this by either using shouts or parties. And so I'm going to talk about that a little bit more as I go on further describing each application. So with Growler, they have a feature called shouts. And so on shouts, you can basically make a message that can either range from 5 to 20 mile radius, and you can literally say whatever you want to whatever users are using that application. Initially, this feature was created for people that wanted to hook up on the application. However, we used it to offer our free screenings. So on certain clinical days, we will post 2 hours in advance, like, hey, Howard Brown is going to be in the area for free screenings. And then whoever is in that area at that time will get that message in that area. So you'll probably get about 30 people that might get that message, and then they can respond to it. Another one is Bareback RT. Bareback RT has a feature called Parties. And this is essentially just like Growler with shouts, they just call it Parties. And you can schedule time as well and make different details or whatever you want to talk about, and also schedule those posts as well. And so here on the right-hand side, we have an example for a Bareback RT. And so that is something that you can make a post on. And as you can see at the top, it says ad expired. So it literally ranges from 1 to like 12 hours. Sorry, excuse me. And you can keep it up or you can take it down, and basically those users on that platform will get it. Next slide.
Awesome, thanks Mario. So now that we have a little information on different geosocial apps, some tactics when it comes to messaging and creating your own profile, I want to give you all a little information about the specific services that our team at Howard Brown Health has been able to offer our community members through these geosocial apps. So over here on the slide, you'll see different types of referrals that we have been able to offer to our clients. Number one is the at-home prevention program that we started at the onset of COVID-19. And that's definitely, I would say, our most sought after referral that people will access when they're messaging us online on these geosocial apps. And through the at-home prevention program, clients are able to order either prevention supplies like lube, condoms, face masks, things like that, or they can order at-home screening kits for HIV and STIs. In addition to the at-home prevention program, a lot of clients also message us in regards to PrEP referrals, as you saw on the previous slide with that message on Growler, where the client messaged us asking for more information on PrEP. A lot of people are looking to either restart PrEP or are interested and want to know more about like side effects, adherence, things like that. So we're able to navigate them to our PrEP team here at Howard Brown through these geosocial apps. In addition, a lot of people have a lot of questions about insurance through Howard Brown and primary care at Howard Brown. And lastly, a lot of folks are messaging us about trans services in regards to surgeries, hormone therapy, name changes, etc. So we're able to really utilize these geosocial apps to promote all of these services that not only our team offers, but our agency overall offers. And depending on what type of agency you're working at, or the scale of the agency that you're working at, this is also a really great place just to sort of give a resource guide to your clients in regards to whatever services that you are offering at your agency. Now that we are, offering these referrals to people and stuff like that, we developed a system also to track our referrals to make sure that clients are being followed up with and are being offered these services through the respective teams at Howard Brown Health. So we have our health educators document the follow-up up until the client is confirmed in receiving services or has declined the follow-up. And now I'm going to give a little more information on sort of our team specific online flow and documentation for all of the referrals that we get through the geosocial apps. So the first step is the staff use a pre-scripted template that is saved in the Notes app on iPads to guide the initial conversations. So it's a script that Mario pre-wrote for all of the health educators to just copy and paste into the conversation so we can easily mass message people and get the conversations going. Next step, the staff will screenshot and record any conversations with clients interested in Howard Brown Health Services, and then they'll save that screenshot on the iPad to be uploaded to our network drive. Following that, the staff will import all the screenshots to our network drive and then document the interactions on a Smartsheet spreadsheet for later referral follow-up, as I stated before. And lastly, the staff will continue to check in with clients until the referral is either completed or declined. And next to this text bubble, you'll see a screenshot. That's for one of our geosocial apps. That's like our bio. And you'll see the first line under what I do in all caps. We have free lube, free condoms, free at-home HIV STI kits. So trying to really get people's attention. People love the word free. Everyone loves free things. So making sure you're marketing your services in the smartest way possible, that will really get people's attention and engagement. And underneath that, we kind of break down specifically the services that we're offering, which are at-home screening kits and our pop-up clinics that we offer to community in different areas of Chicago.
All right, so what about staffing? We know that definitely this program is definitely going to take more than just one person, because it definitely can be a lot on just one person. So here at Howard Brown, we have it split up in numerous of ways, and we definitely have one lead here on the team, which is me, for social media. And so basically I spearhead like all the scripts on the iPads and like kind of like make the profiles and things like that, and then just cross-train all the health educators in order to like how to have the conversations with a user online. And then we have a communication team. So our communication team basically just focuses on the agency's online engagement. So that's on Facebook, Instagram, and they control all of that. And then they also coordinate our social media platforms and our digital marketing. So sometimes we have an idea for something to do out in outreach. And so we'll go to communication and say, hey, can you make a digital flyer for us? And then they would make that for us and then share it on our Instagram for us. And then you also want to keep in mind that when hiring someone for your program, that you want to make sure that you're reflecting the community. Definitely want to reflect the people that you're trying to target in your organization, right? So this can be anybody that are respected leaders, activists, drag performers, ballroom stars, or people in the LGBTQ plus community that identify as a person of color. And by having multiple people on your team and having diversity, this allows you to go into different subcategories within the community to reach your target population. And so we kind of like tailor this method like in the outreach team when basically like on our mobile testing units or our screening events or anything like that, we try to include diversity in order to try to target our population. Okay. Next slide, please.
Awesome. So a little information about the technology that we're utilizing outside of the geosocial apps that we've already discussed. Smartsheets has been a really great tool for us. Smartsheets is perfect for registration forms, order forms, and creating spreadsheets to document your data. And as you can see to the right, there's a screenshot of Smartsheet that we use for the at-home prevention order form. In addition to Smartsheets, we've been utilizing Healthvana, which is really great for registration as well, signing consent forms, and releasing results to our clients. So we utilize Healthvana when we're doing our pop-up screening events. It also, in the age of COVID-19, we wanted to sort of direct our team towards a paperless method for registering clients and having as little, physical contact with any materials possible. So Healthvana has been really great in terms of getting consent forms signed and releasing results to our clients. In addition, we also created an email and phone number specific to our at-home prevention program so that, we want to meet people where they are. Maybe everyone doesn't have access to the internet like this so that they can go online and, look up this webpage. So we also have a phone number or email where people can reach out to us directly to ask any questions about our at-home prevention program or any services that we offer at Howard Brown Health. And we've also been utilizing QR codes to further speed up the process and make the registration process accessible to people. So as I said, again, in the time of COVID, trying to make things paperless, QR codes have been really great for registration. We've also been able to use QR codes through paper flyering, so including our QR code, which people can scan and pre-register for our screening sites and kind of get that already done beforehand. So those are some of the technology tools that we've been utilizing. And you'll see the two screen captures over there, the Smart Sheets and the Healthvana interfaces.
All right. So other promotional strategies that you can use outside of the geosocial apps is utilizing Facebook, utilizing Instagram. And so here on the outreach team, we have different influencers or gatekeepers that we utilize to go on Facebook and talk about our services that we're offering. And so we also make different Instagram posts. Like I said earlier, we have a communication team that will specialize a certain day throughout the week to promote our screenings that we're offering on Saturdays or Mondays or Wednesdays when we're out and about. And then even online articles, interviewing with online articles, letting them know about your services. Here in the past, here at Howard Brown, we collaborated with Chicago Reader, Windy City Times, WBEZ Radio, and so much more. We also do Google Ads. So with Google Ads, basically, if a consumer is interested in receiving a at-home HIV kit, we are able to create Google Ads that have like different hashtags that are targeting that audience. So whoever is searching whatever we are having to offer, that ad would show up in the search engine. And then instructional videos. So once the consumer receives like the HIV kit or whatever they're trying to get from us, we have instructional videos on YouTube. And so basically that is just giving step-by-step directions on how they can actually use the at-home kit. And then we use physical and digital flyering. So sometimes during different days, the outreach team goes out in the community and post different flyers about our screenings. And then we also do digital flyering via social media. And then lastly, we have the agency webpage. So as a whole, we definitely just have all of our services online, including primary care outreach and just everything under one umbrella. So these are just some tactics that we use. And you're always welcome to expand your horizons if you want to tap into other different social apps or different websites to like utilize for your agency as well. All right, so on this slide, I'm actually going to play one of our instructional videos that I was saying earlier. This is for our at-home prevention kit. And so we partnered with MyLabBox. And so we were offering free HIV and STI screenings for people that were interested. So if you want to go ahead and press play, this is something that our team created. You might have to hit on it 3 times, maybe. No, won't play.
I don't think the video is going to work because I don't.
Do you have a link to it? You can just click it, put it in the chat box, and we can navigate to it.
Yeah, sure. or you could send it to us later, and then we'll forward it along with the slides to everybody.
All right. If it's easily accessible, though, I think we can quickly present it.
We're trying to pull it up right now. Yes. I'm gonna add this to the group chat. One sec. Thanks, y'all. Appreciate it.
We did not troubleshoot we didn't know there was a video, so that's on that.
Oh no worries. Yeah, that's the YouTube link for the video.
Okay, perfect. Javier, can you click on that link and share your screen? Awesome.
rewind that back to the beginning, get the cute little intro.
Javier, if you have headphones in, you might need to take them out so we can hear it.
Or unmute yourself, Javier Chapa.
You also want to make sure you're sharing your screen. You click that little box that says share sound when you share.
It's a cool video though. I really liked it.
I could almost hear it.
Yeah, sorry you couldn't hear the sound. So definitely say that URL. Oh, let me mute myself. Okay, awesome. Yeah, so definitely, the link is in the chat. Mario is the one who directed that video. I was modeling, as you saw. Definitely check it out. It's a really cute soundtrack, very like 80s ambience. Make sure you check that out in your free time. But yeah, that was, just one of the tactics that we utilize to sort of further promote our at-home prevention services and give clients an in-depth explanation of how to utilize the kits once they get it. So make sure you check that out. Give us some views on YouTube, We can go to the next slide. Awesome. So now, given all the information that we've given y'all on the sort of different geosocial apps that we utilize, the strategies that we've implemented in regards to setting up our profile, messaging clients, and the sort of benefits that we've laid out in terms of using geosocial apps, I want to dive a little into our at-home prevention program. The at-home prevention program was created at the onset of COVID-19. So it started back in April of 2020. And back when it started, we were only offering at-home HIV rapid screening kits and prevention supplies to community members. And community members across the US could utilize these resources. And since this information that you see on the slide is up to date as of September 23rd of this year. And so in the beginning of our program, we were able to send out 377 at-home HIV rapid screening kits to community members across the US. And then you'll see the other numbers listed for the amount of condoms, lube, cloth masks, PrEP navigation referrals, and safer injection kits that folks were able to order through our program. And now we'll move forward a little bit in time to September 2020. We're a few months into COVID and we want to expand our services. So we expand our at-home screening services by partnering with a third-party lab called MyLabbox in order to expand our at-home screening services to include a full panel of syphilis, gonorrhea, and chlamydia screenings for community members. And so since that started in September of 2020, we have sent out 282 kits requested through us, and 144 clients have sent back their screening kits to be processed for results. And you'll see the breakdown of each screening specifically between HIV, gonorrhea, chlamydia, and syphilis that clients ordered. And so we're at about like a 50% completion rate for the amount of screening kits. And we have been able to actually catch a few reactive or positive results through this program, which has been really great because we've been able to connect these clients to treatment through Howard Brown Health. And so we had 15 gonorrhea, chlamydia, and 4 syphilis cases that we were able to catch and treat through this program. Over to the right side, you'll see a map. This map details all of the at-home screening kits that we have sent out to folks. Also to specify, the MyLabbox partnership is only applicable to people who reside within Illinois. So the map that you see to the right is for all the clients who have ordered the expanded at-home screening kits starting back in September 2020. And so you'll see a large clump, all of the kits are represented by the green stars. And you'll see a large, a dense population of these kits are being requested in the Chicagoland area, which was expected, but we have been able to expand over to neighboring suburbs and neighboring towns in Illinois, which has been really great so that we're spreading these services not to only folks
who are in a city, but folks who are maybe in areas that don't have these services provided to them through whatever health clinics are in their area. And next slide. And then just to break down the at-home prevention program a little bit more with some data, this is a breakdown of sort of the demographics that we've been able to reach through the at-home prevention program. So you'll see a breakdown of the race and ethnicity of our clients and the genders of clients that we've been able to serve. And starting with the race and ethnicity of clients, we've actually had a really sort of like equal playing field so far in terms of the types of clients who have been utilizing this service. So it's pretty equal amongst Black, Latino, and white populations who have been accessing this, which is great that, you know, it's not only white folks who are utilizing this resource, but we're also able to tap into these other communities that need to access these services as well. Of course, you know, based on the other numbers, there is still room for growth, of course, to reach other populations who might need these services as well. So always room to expand and, you know, level up our services and who we're targeting through this. Below that is a breakdown of the gender of the clients that we've been able to serve. So definitely still dominated by, you know, cisgender males. A lot of, you know, gay males have accessed these services, and behind them, cisgender females. We definitely want to make more of a push to push this service to our trans and non-binary communities to get those numbers to grow a bit more. But that's sort of a breakdown of the information thus far. To the right, you'll see a map which is laying out the prevention supply aspect of the at-home prevention program. So these are folks who have ordered prevention kits, which include lubes, condom, safe injection kits, PrEP referrals, and things like that. And this is just a capture of the Midwest. The prevention supplies are able to be shipped out to anyone in the US. So we do try to promote that so that folks all across the country are utilizing this. We've had a lot of people from like Atlanta, Georgia, some from like Texas, even some from like Puerto Rico access this. But this is just a capture of the Midwest and sort of the different areas that we've been able to sort of target through this program so that it's not only based here in Chicago or Illinois.
Awesome. So now that we know how to set up your profile, how to message and engage with your audience, even do a large, massive group messaging, right? You're gonna run into some challenges. And here on our team, we've ran into challenges. And so some of the challenges that we have faced was some of your conversations might end early. You might have clients that might reach out to you outside of your business hours. So that can be on the weekends or after 5:30 or 5 o'clock. And so you might not be able to get back to those users or clients until the next following business day or the next week. Sometimes users just delete their profile. Sometimes they're just there just to have fun for one night and one night only. And then the next day they delete their profile. And so those are potential users that you can possibly miss out on, or you might be having a great engaging conversation with them and then it might just out of the blue end, right? Another one is just getting blocked or spammed by other users. Sometimes some people that use these applications don't like health educators just being on the apps. So sometimes they might just want to bother you or just try to get your account shut down. That has definitely happened to us in the past. And so either you can just create another profile or reach out. I personally reached out to certain applications, emailing them, just trying to explain to them, and most likely they will just lift the ban off of your account and then just reactivate your account. Repetitive users. So we've noticed that like on Jack'd or Grindr, if you don't have like a pro account or if you're not paying for like these pro profiles, sometimes you're limited only seeing so many users a day or the same amount of users in the same area. So if you're doing community outreach and you're in that same area throughout the week, you might run into seeing the same people on those apps. So you might want to move around in your area, just trying to target new people, okay? And then, yeah.
In addition to these, sort of challenges or opportunities for growth that we've encountered, online traffic is definitely one that has been a recurring challenge. So online traffic can be really unpredictable. You can't tell when people are going to be online looking for, whatever it is that they're looking for. So it's hard to kind of plan when to access these services. Online traffic can be really unpredictable throughout the day. It can be unpredictable throughout the seasons as seasons change. You know, maybe in the summer, users are more active online. People are trying to hook up more and, you know, be seen more. And then maybe in the winter, things, you know, slow down a little bit. It's cuffing season. You got your boo. You don't want to be online looking for people. So you're already good, you know. In addition to that, also traffic fluctuates with, you know, holidays or any special events that might be happening in your city. Of course, we're based here in Chicago, so we have a lot of special events that will happen here, like International Mr. Leather, the rubber event, like all those sort of like specific kink events. So those are really great times where we get like an influx of people in Chicago who could be targeted for these services. But on the flip side, you know, holiday times or other times, maybe people are like leaving town, people aren't active online as much as they were before. In addition to this, I'm going to kind of cater now more towards challenges with the at-home prevention program that we've had specifically. Client follow-up and client follow-through on at-home HIV STI kits has definitely been an issue. As I laid out in the previous slides, we had about like 280 something screening kits requested, but only about 144 screening kits were sent back in to be processed and tested for results. So definitely trying to, you know, find ways to get clients to stay engaged with the program and follow through on their orders so that they're able to get, you know, a check-in on their own sexual health status. In addition to that, as I stated before, we've been partnering with a third lab party, which has been a new change for us and has proven to have, you know, some complications along the way, including delayed turnaround times for screening kits or delayed communication, as the third lab party that we're partnering with operates outside of the same time zone that we do. So having to negotiate, you know, scheduling meetings and stuff like that can be a little tricky sometimes. So these are all some of the issues that we've kind of run into, but of course there's always a way to find, you know, a solution to all these problems and find new ways to access and engage with our communities. And yeah, that kind of summarizes all of our work so far on our social media engagement. I want to thank y'all, first of all, for being here, being present, giving us your attention and your time. In addition to that, I just want to take a moment to like thank all of y'all, as you know, we're all working in healthcare in the time of COVID-19. I'm sure y'all have been stressed out a lot over the past year. So kudos to all of you who are out here in community doing the work that needs to be done. So I hope you take a moment to, you know, appreciate yourself and the work that you do as well. And here's our contact information. Yes. And now we'd like to open up with any questions that you might have for us.
Thank you so much. There's a lot of love in the comment box right now, and I appreciate just all how in detail.
Oh, Joseph, we can't hear you.
What? I'm just talking, no hearing?
I hear Joseph.
Really? Oh, can you hear me now? No?
I can't hear anyone.
Oh,
Can you hear me?
We can hear you, Joseph.
Oh, thank goodness.
That's weird. Yeah, we can't hear either of us. I'm not sure what's going on.
I wonder if anyone else can let can they? All right, so you can hear me. Everyone can hear me, but Mario, Javi, you can't hear me. Well, I can type my thank you. I just wanted to say thank you so much. Can you hear me now? No?
Yeah, we can go.
Oh, thank God. Well, I was just saying a lot of love in the chat box for you both. And thank you so much for just how much detail you put into your presentation. It was honestly just like the icing on the cake after today's presentation. I really just want to say, like, the work you do in the community on these apps, like that's the insight that gives everyone here today sort of that energy, I think. And again, the themes from today were collaboration, and I just appreciate how much you integrated that into what you taught us. So thank you for that. And I do want to encourage anyone who has questions to ask them now. And if not, I do have a couple for you, but I'll open the floor first. Also, it is officially cuffing season. You're right, Javi. Like, it just started. That's why I wore my little, you know.
The weather's gonna be a little chilly, you know.
I know, yeah. Just a visual representation of where we're at now. But I still want to be seen, you know. All right, no questions so far. I did want to ask just about like your team, how you made such an awesome, it seems like it's a smaller group, 6 I counted in the photo. It seems like your program itself like looks for these positions. So I was hoping that you can give everyone here like a little rundown of the positions you have on your team, if they're interested in expanding their team or creating new positions so they can effectively do what you all do here locally. Like what does that look like? What are your roles?
Yeah, so initially starting off, basically, I was the only person running the social media team, and then it expanded over the years. So like I mentioned before, I am the lead on for social media wise, and then Javi also does social media and at-home prevention. And then along with all the other health educators, they're also doing that as well. They kind of play the same role in all their aspects. So we all just share the same role. We just switch out when we go to different sites. So like we might pair 2 and 2 at this location and 2 and 2 at this location. So we're all essentially just doing the same thing.
Awesome, thank you.
Hi, I'm sorry, I'm driving. I had to pick up my kid, but hopefully you can hear me. I am just wondering if you have adapted your working hours at all to like be online potentially, like when people are more likely to use the app or apps for like hooking up. So like over the weekend or something. Like, do you intentionally try to stuff time during those hours or just try to do it Monday through Friday?
I would say like in general, like primarily Monday through Friday, you know, we stick to like kind of like our hours of operation. Since we are on the outreach team, our hours can be a little different than other team members in like the agency. So we'll do weekend screening pop-up events. And at those times, like on Saturdays, we'll go to like thrift stores and do a pop-up like HIV STI clinic. And so when we're running those clinics, we also have staff members utilizing the iPads while we're working the site to kind of get people to come into the site to be screened, or also just to do online outreach and promote the services that we're doing. So it kind of fluctuates. Some weeks, you know, we have weekend sites. We'll be utilizing the apps on the weekends as well. Other weeks, you know, we're more 9 to 5, Monday through Friday. So it fluctuates a little bit. I would say in the beginning of the pandemic, when everything was really kind of like up in the air and like no one knew what was happening, we definitely sort of had more flexibility with our job responsibilities to really sort of focus on the online outreach aspects, since our team wasn't able to provide in-person services for health screenings. So our sort of focus shifted to the online aspect. And Mario would be out with an iPad, like driving all around town, like to every neighborhood. He was zooming across the city, just trying to be visible on the apps so that people could, you know, catch our profile in whatever neighborhood that they were in. And I feel like your hours were kind of like, you know, it'd be like a little later and stuff like that. It would be like a little more flexible. So
yeah, so like certain days, during especially like I would like go out from like 6 to 8 because I knew that's one times where people would get off and like off work and they're like looking to like into things or whatever. So I would just log into those apps during those times. But like Javi mentioned, those were like during COVID times. So now that we're kind of like back in like the office and like our outreach flow has kind of like our structure is kind of different now, so we're not able to like really kind of like attend to those users, you know, outside those apps. But yeah, you can always feel free to like, you know, do that if you want to. So you don't necessarily have to like go by our own.
I think, yeah, it's like just really important that you sort of like establish a team of people who are committed to teamwork and like community work and kind of being there for each other as coworkers, so that, you know, you can set a schedule like where maybe someone does have that weekend shift where they'll be online and stuff like that. And then other people will take that role during the week time, you know, so just adapting to your team and their capacity, you know.
Yeah, thank you. I appreciate that. I just have one more question, and it's okay if you don't have an answer, but Oregon is fairly rural. And so many of our health departments or the community-based organizations who might help with like a social media outreach or engagement, like using a geospatial app to do that would be rather challenging in like a very large rural county to like reach many people. And so I'm just wondering if you have any I mean, I assume in that regards, a different app like Facebook or something would be a better use, but I was just wondering if you all had any like good strategies or recommendations for like more of a rural, less urban space.
Yeah, so you can use Growler. Growler is like literally like using shouts. So like you can literally input your zip code where you're at. And so you can go up to about a 20-mile radius and it'll literally message those users in that surrounding area. And you'll be surprised though, like there's probably some users out in that area that are probably using Growler, or if they're not in that area, it's going probably further than where you're at. And if they don't really have the resources close to them, they might even travel to you to get those resources. So like definitely trying out Growler. We started off with 500 credits and that was like $450. And I think it's like $1 per mile. So depending on how many miles you want to use for your shouts on Growler, it's $1.
And I think also, of course, I can't speak specifically to, the agency you're at or like, the community you're in, but I think there is also a lot of times like this misconception that, like only people in cities like have this like technology available to them or are utilizing like cell phones and things like that. But most people nowadays do have like a smartphone of some sort, do have the ability to like access these apps and stuff like that. And so I think, a lot of times we think like, oh, it's only in the cities where like the apps are popping or people are online. But a lot of times it's in those rural communities where people don't have these public spaces where they can go to reach other community members who identify with them. Of course, here in Chicago, we have a literal neighborhood that's dedicated to the LGBTQ community, you know what I mean? So you can go in person and find people who are like you. And I think that's not the case for a lot of small towns, a lot of rural towns, where you do have to actually turn to these technologies to connect with people who identify with you or who, are in the same, experiences that you are. So definitely don't count out, these geosocial apps, because I think you will be surprised that there are a lot of people who are online, whether or not, they're physically visible, maybe people who are more discreet, don't have like photos and stuff like that up. But I think you'll be surprised to see a lot of people are going to be online, searching for other people for whatever, want it is that they have. And that's why I think geosocial apps are such a great, resource across the board for everyone.
Thank you so much. That's perfect. Thank you for speaking to that.
Yeah, I really appreciate that question, Alicia, especially because we have a lot of presenters here today from different areas, but I think the point still stands that some of these apps are, especially during the time of COVID, the only way people are connecting. So I think it's especially important for everyone to like develop and at least start the foundation for their social media outreach. So I really appreciate you sharing some of those screenshot processes, what you do with your iPad. And I wanted to ask if you're able to share some of those processes or those procedures, if anyone here wanted them. So I'd encourage them to reach out to you if you're willing to share those. That would be really helpful. Yeah.
Definitely feel free to contact us like through our contact information on the last slide. This was like a totally, of course, like social media, as Mara said, has been going since like 2018. But sort of the utilization of social media with this at-home prevention program that we created, it's definitely been a totally new playing field for us, where we're also learning as we go. We're learning new tactics, new strategies. We're having failures and successes. So definitely reach out to us, for more information on our strategies and processes, because we'd love to see, more agencies utilizing these tactics to reach more community members, wherever you're based. So definitely feel free to reach out.
100%. Javier, I feel like I'm interrupting you, but all I wanted to say is that one of the goals of this webinar is to start this conversation and hopefully see if there's interest here in the state and maybe eventually, larger area, but for social media, like influencers or strategies sort of work group. So everyone can share these successes and share these processes so that no one has to start from, from nothing. And like today, I really appreciate you sharing those things, because I think, again, what we've learned is like, you don't have to be the expert. There's a lot of collaboration that happens when we create these posts or we do this outreach. So, eventually it'd be really nice to just start that work group so that folks can share these resources. Javier.
Yes. So, and I'll just say thank you so much. And I would like to say that if we look at our three presentations are very deep within their community and knowing what their community, the apps that their communities are using, where they can reach their communities, and what posts engage with their communities more. And at the end of the day, it really goes back to hiring people from those communities in order to do that work, and really cultivating that environment and seeing that, you know, an app like Jacked, I know, is coming from Southern California. In LA, it is a larger area and it is widely used there. But really keeping your ear out, and as you're meeting with folks, testing with folks, really getting like, what apps are you on? What's happening? As you know, a lot of times, as you get older, if you're not actively part of that community, you could really be out of touch with what's happening. If you're not hiring the people to use these apps that would regularly use them, it might be very difficult to really connect with the community. And love being an ally. I think we all love allies, but it is different to hire from within these communities. And really, I love your point of view with the diversity of those, the diversity of the hiring within your department, and then also that diversity and amplifying the different advertising methods to the subgenres. A lot of the time, I'll say, when I was working in Orange County with Growler, we kind of had not tapped into that. As we started doing shouts, we got 3 positives within that week. So, you know, so it is these things where, like, a lot of times, you know, we're overseeing these sub-genres and these sub-communities that may be very large in your area. And also, you know, we can go old school. We can go to Adam for Adam. We can go on Reddit, message boards. You know, there is so much of social media. And at this point, I'm kind of giving myself a plug for Prep Connect, doing a further social media locally here on Monday. So if you're going to be on that, but thank you so much. I really think it really kind of ties together, and really seeing the different tactics from West Coast, Midwest to East Coast has really been different. Also seeing that, like, that tie in to LinkedIn with like working professionals, which is what a lot of DC is. So really loved all of our presentations today. If there's any other questions, we have about 2 minutes. Also want to remind folks that you will be getting a survey and evaluation for us, and we'd love to hear back. Just like Joseph said, we are listening to what you're saying. We really want to be able to develop and really help out with what you want with social media and digital engagement strategies. If it is a work group that we can work together in order to put through, definitely something we're looking at here at OHA. But I'll open it up for the last minute.
I think really quickly, one note, also just like a suggestion, as a part of our registration process, when we use Smartsheets and people are filling that out, we do have a section where people can identify the different geosocial apps that they are using. So we can be like, oh, like, how have you met these people that you've been hooking up with? And they have like all the geosocial apps where they can check those off. And we also, you know, like ask that in screening sessions, just so we can kind of give like that like heads up of like, oh, we've got a lot of people like on Growler, maybe we should, you know, do a Growler shout soon. Or as Mario said in the presentation, there's also always new technologies coming out, always new apps that target, you know, subcategories of our community that aren't given these spaces. Of course, a lot of apps are, you know, for men seeking men primarily. And, you know, what about like the trans non-binary people who are trying to, you know, hook up and stuff like that. So always just staying engaged with your clients and talking to them about the apps that they're using so that you can find out what apps your team should utilize in the future, you know, just so you're always staying on top of the game.
And I think for that, we're really ready to close. Thank you so much, Joseph, and thank you, Shelley, for being, thank you to all our presenters. I wish we would be able to give you a round of applause. I think everybody, we will be sending the slides on through later. But I hope everybody, thank you for sticking through all the way through, listening to everybody. I think, do you have anything to say, Joseph?
Just that I'm so grateful, kind of like Javi said, that we are all working in this field. It's inspiring, and I just feel a lot of drive, especially as we close out this year. It's really scary for me to think that it's almost 2 years of this. But it's also really, really inspiring just to see how much is being done across the country. And I just keep coming back to collaboration. It's really nice that all our presenters made time for us. And we, again, I just thank you from the bottom of our hearts for making that time. Everyone here I know is gonna, in some way, shape or form, use this to better their programs and to reach more people. And this impact is gonna make hopefully a lasting change. So thank you so much.